planning and preparation for entering the market or introducing a product service. That is what a GTM is actually. So it's a launch of a product or service. For example, in Mansi's case, what you're trying to do is in your stuff, you're trying to do a CKD product. How do you launch it? How do you do it? And also you should have some kind of a timeline goals when you do a GTM. Most times GTM is mistaken for sales. Oh, we are still doing GTM. GTM is different, sales is different. And then some of the important things, there's a slide coming along with that. The value propositions is very important. Like the way you said, you get 10 minutes, 15 minutes, but if you are not able to share both the clinical and financial value propositions, the challenge, pricing, messaging, those are some of the things we need to be looking at. So I have had experience of selling larger software products. I can tell you that part a little later. So those are the things. So in just what it is don't rush to do that, get things right over there. Because doctors also have a view around, hey, this is not completely ready or something for them to adopt, especially if you're trying on a patient. So sharpen the whole thing and enter. And then GTM is what? How does your day one look, week one look, month one look after that? So that you need to have a strong launch. That is what a GTM is. It's derived from your World War II, wherein you had a beachhead to enter the market. So CKD can be used in maybe a diabetic care center or a dialysis center or even a kidney care. I don't know what are the things over there. Where do you enter? I'm just taking her example because that's the only one I know for today's session. How do you do that actually? So when you do that, how do you create interest? A lot of inquiries without a lot of follow-ups happening also. Convert to paying customers fast. This is a top part of what GTM is. What GTM is not is it's not a regular sales cycle. Every day you say I'm going to eat, etc. It's not there. You need to have a timeline, etc. to do the GTM. That's what it is actually. And it's not to be done again and again. So we'll talk about all aspects that constitute a GTM to be done once properly. This is the important slide I want all of us to be aware of. What constitutes a go-to-market planning? Most people think it is market access, right? Give me market access. I got a lot of questions. I know how to enter the market, etc. But I beg to differ here. According to me, firstly, a product or service has to be ready. In the sense that clarity on what is the problem it solves, what is the outcome you get, customer profile, are you selling to the patient, are you selling to the doctor, benefits, differentiation, value proposition, and proven. I will not say everybody's can be proven. I completely understand. Some of them are novel. So this is the first part of it. You get a meeting, but will you convert that meeting? This has to be very strong. Otherwise, they just think of it as some toy, some app you're trying to do. If you're able to prove, I'm just taking her case, that it indeed moves the needle and for example, it moves the needle and then from that point onwards, it is helps slow down the onset of diabetes or something, that's called useful. Business. Everyone is running a business, right? Even a doctor or a hospital, right? So how does it increase their business? Will it result in more patient footfall, productivity improvement, or anything else over there? And then your pricing, business models, differentiator, competitor knowledge should be there, but you shouldn't be speaking around it. This is the second clear aspects of a GTM. Third one, now we talk of market access. Having got these two right, now you go and market it. Different channels, position it well, the right way or that you see is appropriate. Then we look at the channels and when we look at the geography. This is what the whole, what I can say is canvas of GTM. Most people look at market access of the GTM, but these two are hidden and the foundations of it. Get your product right, etc. You get the chance, but if you don't do it right, this access will be wasted actually. Second thing you need to look at in your GTM strategy is where does your product or service fit in the value chain? For example, let's say there are 4 of them. Is it a screening device, diagnosis device, treatment device, or a rehab? Why I bring this to you is that all devices, software, or anything can be bucketed under that. And you need to know your position in the value chain. When you're selling to a hospital or a lab, where do you fit in? If OT or the treatment is the most valuable part for a hospital, profitable also. So this is done, that is the meat of the whole business. Screening is fairly easy to enter, you can get away with it. Diagnosis, okay, slightly this one. Rehab is the toughest one to do. I just tell you, having worked with some rehab companies also. Because people have gone through these 4 stages, patients, there are no need of a rehab immediately. So selling rehab solution is tough. So you also need to know where am I in the value chain, and there are some challenges in each one. So your knowledge of the value position chain is very important. The lower you are, you cannot enter on your own. You need to take the help of the previous incumbent or someone 2 steps before or something. So based on your position, the GTM strategy differs. So Manasi, for you, does it make sense? Where does your stuff fit in? Treatment or rehab?
Actually, I would say both treatment because we help in treatment adherence as well, and rehab because there are transplant patients who need, continuous monitoring. So that's where we come into the
Correct,
picture.
correct, correct. So now you understand where you are in the value chain.
Right.
Right. So that's the challenge. See, this is a funnel. So what happens is screening is the widest part of the funnel. As you go down, it kind of shrinks over there. Rehab is the smallest piece of the whole thing. So if you have to look at your market sizing also, how many patients have this CKD, whom am I serving actually when you're trying to do that? Or is it selling to doctors actually? Because doctors try to look at the end as what am I getting out of this whole thing? Is it helping my patient or what's happening? Right. So you are in the last part of the value chain. Okay. Or one step before that. So the importance of GTM, I want to spend a couple of minutes on. This is a deck or a what you call as a graph from a famous book called as Crossing the Channel. So in any technology product, this is the way it curves happen actually. You get early adopters, early innovators who adopt it. But moving from early to early majority is always a challenge actually, unless you get your GTM stuff right. And you see this chasm over here. This is where 90% of the startups fail actually. You heard of this huge mortality rate of startups, right? They, along with other problems, also don't get the market right. And that is where the whole thing happens. So if you're not thinking from a go-to-market perspective right from the beginning, you are in trouble. So what happens is there's a delay of several months of your launch, or you launch a wrong product, cost, reputation, sometimes first mover advantage, cost increases, delayed revenues, competition. These are some of the things that really happen over there. And at the end, actually, the startups also shut down actually because time is also a finite value, right? You can't keep on pumping money or something. So that's what happens. They will be in a zombie state and then they shut down. Most times it's attributed to, oh, we didn't get funding and that's why we shut down. But having seen hundreds of them, I can tell you, having run also, that it's mostly because of the foundation issues of problem validation, value proposition, or go-to-market. That is the reason, actually. Another reason why uh, it's not thought through is that I worked with several incubators, including MSMF. Right. So some of the way we as entrepreneurs, health tech entrepreneurs, see is that we spend a lot of time on product development, clinical, regulatory, ICP, and all. But this last piece, right, we don't spend time at all. We think after everything is done, then I'll think of market access. Does it make sense, JCL, if I were to call you out and ask how it's done?
Yeah, that's true. In most cases, we do that. We don't think much.
Most people think, oh, let me get my paper right, my publication right, or clinical trials right.
True.
It's
Even people coming to
postponed.
us, they put importance to the clinical validation and getting their product out, not to the market exactly.
Yeah, this is a big thing because you need to be sensing the market at all stages, right? The market is a dynamic beast. You cannot just be doing it. So this is one of the things I have seen. Oh, we will think of marketing after sale, after the product is ready. Dangerous word. You might have built something that is not at all needed. So that is what we in GTM for also endeavor to assist you in different stages of your market. That's the last one. So coming on to this, GTM has got several stages over here, which you need to be thinking: problem validation, value prop, ICP. As you build a product, assets, testing it out, field visits, marketing. Even before you launch it, you should be looking at where are all the places where we could do that actually. And then, of course, other talks about feedback loops, lead generation, marketing. Always keep marketing at the front and doing it, right? So this is the other one which will go a little deeper. Once again, I'm bringing it up. Now we look at the channels. I'll talk of 2 to 3 in this one. There's one more deck I've got. If time permits, we'll get into that. So dealer, distributor, all of us have heard of this channel. What do? Come on, go ahead, guys. I'm okay even if the answer is wrong. I don't want to be just a alone person speaking. What are dealers, distributors doing? What is the role in the whole healthcare ecosystem?
Probably the who is the connection between you and the audience, like who the product
Correct.
is.
They are also a last mile connectivity in some way. So one of the way they exist is also they are very fast in taking mature products to the market. Very, very good. Second way you can look at dealer distributors. They have a lot of, let me tell you, they bring in a lot of trust and relationship with hospitals and labs because of their constant selling or whatever it is over there. So you need to be using this channel for concept selling. For example, if you're building something novel that is not perhaps known to the market, you need to warm the market. Mansi, again, I'll take your case because you spoke actually. You need to do some amount of concept selling as to how your product assists CKD patients before they warm up to the sale, Mansi.
Okay, so when you say concept selling, it's basically creating awareness about.
Yes.
Uh,
First meeting itself, don't go and try to sell the product. First meeting, I advise you go meet them, tell them whatever your company name, this is what Kifai Health is doing, this is what you're doing, what do you think of it? Get something to warm up to them rather than just saying lay low kind of thing.
Yeah. Correct. So what I have done is we've prepared a sort of a small pitch deck wherein we try to sort of share with them that what are the common problems which most of the doctors face, and how we could help them and whether they see value in that.
Good, because I
So
have not seen many CKD products in software. So that's a novel thing because CKD is all a very complex thing, and then it leads to
correct.
dialysis, a lot of things, right?
Exactly.
So I have not seen any product, so they may not be interested, or even dialysis itself is a big challenging thing with respect of number of dialysis institutes in India. So many things are there, right? So look at it as what it is you're able to track by this product. How it benefits doctor, how it benefits patients first. Concept selling is very important. Once they are warm to the concept, it can be sold directly also. Even patients may buy it.
Right. Absolutely. Yeah.
So that is one thing I advise you to do. Look at firstly concept selling. Use dealers, distributors, trust and relationship they bring with the labs. And look at door openings, medical devices. This is not for you, not in the medical devices, but that's the way to do. Okay. Second one is a pharmacy channel. This is also a GP-oriented product if you are having something around new biological molecules, etc. This is one that most pharma companies use. The way they do it is provide samples and they get a clinical advocacy. Why are we introducing this? How is it benefit? And they win the trust of the GPs through these MRs, free samples, whatever it is. In effect, what they are doing is similarly here, a new product, concept awareness education. That is what they are doing. Once it becomes aware, then it becomes as good as an OTC. It will not even be a prescription drug. There are 3 levels, right? Concept and then prescription drug and a OTC. So you have to go through the thing, especially when you're building something very novel. Otherwise, you have got a different channel you need to go to, which we'll talk about. Bundled offering, you build something very small. Then what we advise is also don't build a separate sales team to do it. Align with a larger part and bundle with it. For example, somebody is having a maternal child healthcare product. So somebody is building a maternity center. So a lot of things go in OT, a lot of things, right? Just align with it and build. Those are greenfield projects, big ones. So you have to do that way. So hospital project. These are small ticket items, scrubs, masks, gloves, right? So you have to look at something. How can I ride on somebody else? That's the way to do it. Home healthcare, rehab product service. This is also something you can do, Mansi, because it's a rehab product, right? How are you able to reach rehab? Is it only for diabetologists or is it only for also for CKD patients, right? So if it is can be used by patients, that's a way to tap into, right? Post-operative care, nurses channel, that's also nurses channel, physiotherapy channel, so many of them are there. These are top 3, 4, but I'll go in little more detail in the next one. Next one you need to look at is which segment are you selling for? Because segments are so many in the healthcare industry. Right? I'm just putting up all of them here, right? Are you selling to hospitals that have got some segment? Are you selling to lab product, pharmacy, pediatric, or are you selling to government? Each one has its own, what I can say, sales cycle, lens sales cycle, and other things over there. And if you're selling to B2C, the sharpness should be there. Whom are you selling to? Senior citizens, kids care, middle-aged, men, women. And I'll just take her example again. This CKD is something that comes also with NCD, right, Mansi?
Yeah, yeah. In fact,
Correct, right?
WHO has recommended that it
Correct. So
has
it's
to be
a
ready. Yeah,
bundle of offerings. When you say NCD, you got chronic care, you got cancer, you got diabetes, so many things.
correct.
So you need to be sharp around what are you solving for, right?
Mhm.
B2B or a B2C, this sharpness must be there. Because selling to a lab is different than selling to a hospital, so many things like that. So this is the one. And now comes the marketing strategy. How do you get discovered, right? Are you going to trade shows? Have you participated in any trade shows?
Not yet, Shashi. We inquired about the conferences which happen particularly for nephrology, but they were pretty expensive on the pocket just to have a stall over there, and we are too early for
Sure.
that.
You need to plan that also because visibility is important, folks,
Correct.
right? Without that, no point doing it. So marketing budget is important, trade shows is important, right? Trade shows. Some of them are like medical or generic ones that everybody participates, but something like nephrology is a very unique one. And in these, you need to look at concept awareness. Hey, what are we trying to do? Content creation is also important because unless you write about that, people may not know in leading journals. Third is continuous medical education. You need to have KOLs, this is key opinion leaders, talk about your solution. So only when it reaches through them, then the lower fraternity or the whole tree structure kind of thing will also know, oh, this person is advocating this, so it must be good for us to do it. That's the other way to go to market. Key opinion leaders, endorsement. Social media, everybody does, but I'm just not a big fan of that. These are the top 3 or 4 important ways to discover yourself. Next, let's go on to marketing and sales, right? So why I have this slide on marketing and sales is most people think they are same. Marketing and sales, right? They're extremely different, like chalk and cheese, though it's kind of done. Marketing is a lot of work you need to do on awareness creation. We spend lakhs, crores on building the product. You also need to spend time and effort and money on marketing. Awareness. This company is available, this company built something, or let's try it out. You need to make them aware of the concept. What is this? What is CKD? Why are they tracking CKD? I'm just taking an example since I know it. If others can chime in with their product, I can help also. So that intrigue, interest should come in, concept selling should happen, then they do it. Marketing is extremely important. You have to have at least 6 months of marketing cycle for you to build your sales pipeline, because that it happens. And still everybody is still recovered. I think they have recovered from the COVID 2 years lost actually. Marketing is the one that creates your leads or pipeline. So get that right. And sales is the one fairly easy. Once the leads come, you meet customers, tell them about your product, service, and convert them. Conversion happens, and then you generate leads, upselling, cross-selling, right? So tell me, is there any effort, if any one of you are doing in specifically in marketing, having challenges that I can address? I can't see everybody here, so whoever is present, you can ask questions.
So again, I think no one is
Sure, go ahead.
I'll just volunteer. So in our case, uh, we are reaching out to patients via the specialists. They are the nephrologists, because as you already correctly mentioned, CKD is a complicated condition, and nothing happens without the consent of the nephrologist. The patients don't do anything, and in fact they shouldn't be. Since
Yeah,
personally we also have been through that journey. My father-in-law was a CKD patient, so that's how the entire journey started, so we understand it very closely.
very good.
What I'm trying to point out here is that it is sort of difficult, because what we have understood is that anyways nephrologists are in dearth in India, and there are very senior nephrologists who may not be that open to technology, and the younger generations, they are because they are they may not have that much time to, go through various marketing campaigns unless I specifically meet them in a conference where they are attending some.
Good, good.
So
Yeah.
it's a very, very limited, space or area where I can think about reaching out to my target audience. Even if I do a lot of social media content in terms of, as you said, not from like coming across as a thought leader when it comes to CKD, but I'm really not sure how many doctors or how many CKD patients, or for that matter, how many caregivers would actually go through these posts, because they are anyways
Correct. They have a
overburdened.
bigger challenge, right? So again,
Yeah.
what I would advise you, Mansi, is relook at the problem definition. Maybe the way you're thought through and maybe the resonation happening is maybe some kind of a symmetry or something, because go back to the fundamentals. What is it you're solving? Because if that fundamental problem is not there, right? If you are already accessing the market, why is it not coming through? Right? So is the problem, well, is it something to do with that? So it's just relook at that part is what I would say. Then I kind of will move forward. When you launch a product, how do you do it? This is the GTM part, right? You need to look at tailwinds. This is all right. What Manasi was telling us about some headwinds she's facing on access and all. You need to look at what geography you choose. Pull for your product is key, right? One is paying parameter. Who pays? Any product or service, if you're selling to somebody, is it a patient himself paying, or government is doing, or insurance or healthcare? This is a clarity you need to have in your GTM. Because if the paying markets are not there, tough to sell. And in some cases, global or something, sometimes they're controlled by insurance standards, regulatory markets. They are good. For example, UK has an NHS, US has insurance bodies. So there are certain things they say, if you're on insurance, you need to be tracking this and giving this report, or doctors have to do it. That kind of comes with as an easier adoption cycles. When there are no big brothers or anyone playing, this is needed for this.
Really?
Sorry? Okay. So you need to have a pull. So the market is big, Mansi. India is the diabetic capital of the world. So there is a big market. So what is it that you kind of have to look at? You should look at that.
Meeting it too.
Yeah. Can someone mute yourself? You can do it. Or a large push is needed. If you're pushing it, how long will you keep pushing? There should be a pull also towards your adoption of your product or service. Very, very important. Mistakes sometimes is that large population is large market, etc. So if you believe India is not a right market, I think you should look at international markets where if you go for a certification and there's a better appetite to pay. So look at that kind of markets also. Now, how do you launch your GTM in a way? Choose a geography that has major traits of your intended target population. Maybe I think the paying population is important. Which you said you launched it in which city, Mansi? Bangalore, right?
Yeah.
Right. Yeah, it's Bangalore has got something you can look at a paying population. So I'm surprised why you're not doing it. Don't spread yourself taking on too many geographies. Understand patterns, what's working, what are they taking, why are they not taking it up? If they are not taking it up, is there something wrong with the problem itself? You should look at it. And work with a project. We tell that you should get a problem validation in 90 days time. Clearly, we have seen lots of startups work with us, get it. Sometimes they pivot also. But this is not a right problem. I'm glad I came here, we did it. Start date, end date, intended outcomes. Who is the target segment? What is the FAQ to your customer queries? This is the way you should look at measure results, right? So you should also look at if I give it for free as an entry pricing, will it kind of do it? Or even if I give it for free, will they not take it, right? So you will have a lot of hypotheses when you launch your product or build your product. Are my hypotheses proving true, or just that I did not get that hypothesis right? What is the market reality? This is a very important part. And there's nothing wrong if you're in your GTM, you realize some parts of your product need some pruning, changes, etc. It happens. But that's why we say, come to GTM as early as possible. Don't delay GTM. Okay. Next, there's a lot of checklists we've got. I've just for this session put up a few lines around channels and other things, value propositions, features mapped to benefits, funnel. Funnel is very important. Brochures, testimonials, YouTube videos, pricing chart. So those are some of the things we have. Much more is there. We have a complete GTM checklist if it's a B2C or a B2B, if it's a product, a different GTM checklist, if it's a service GTM checklist. So everything is like a playbook, a science kind of a thing is what we help out and do that part actually. So what I want to do now is the next 10 minutes, I want to walk you through one of the channel partners. Some of you asked, and that's also the agenda of today's presentation. Has my slide changed for you all?
Yeah, it has.
It's changed, right?
Yes.
Okay. So the slide should read channel partners management. Okay. So I will be talking of only one channel today in depth and then touching upon others. Why channel partners? See, I think you have to look at, can I do everything myself with me, my sales team, or will I leverage others? That's the reason for channel partners management. How will channel partners work? How to create win-win model? This is the key, guys. There is already a last mile, but how you leverage it is extremely important. That's why we call it as a win-win model. How do you do it? So the agenda I got is a lot of wrong information also about channel partners. So I begin with the 101, who are channel partners, when to have, type of channels, how they work, business partners, how to compensate them, when to engage, do's and don'ts, etc. I think this is run something we've built with our experience, because we have also got channel partners, dealers, distributors we work through. So it's validated everywhere, skin in the game, how to look forward and all. This is the session on the second part, dealers, distributor management. So I will take around, I may take a little more than 5 minutes after 5, since we started late. I hope it's okay. So who are channel partners? So the demographics of a channel partner is something like this. They are the last mile connectivity to business guys. They are the one who deliver from a manufacturer or whatever it is, the final deliveries to the intended recipients. It could be B2C, a patient, or it could be a B2B, a hospital or a lab. And for you to look at them, you need to look at them as complementary products and services. They are a kind of a channel. They sell a lot of things. So how do you leverage them trying to take your product? They sell a lot of complementary products. They've also taken distributorship of product service of a well-known brand. These are the traits to look forward. Any big MNCs or Indian large companies, they will be the dealers, distributors. So this is the way to identify this person is a channel partner. And they keep visiting your prospect. For example, diabetic care or a dialysis center or hospital, they keep selling, meeting almost twice a week. And they are the first point of contact for the hospitals also, in case they are trying to sell something. And why do they do this? They are also, in addition to their own work, there is a lot of competition. They're looking at additional sources, then they take up partnerships. And it works only if it's a fast moving groups. So if you're trying to engage them to something very slow moving, very tough, unless you have some other model to keep them motivated. For them, it is all about what has a higher margin, what moves faster. These are the two, what I can say, metrics you need to keep in mind if you're looking at channel partners. Now, when do you think you should have channel partners? Channel partners are for scaling. You know, my product sells well. It has got regulatory approvals, clinical trials done. I've done some myself sales of it in reputed institutes. I know there is a clear sales process. Then is the right time to involve a sales channel partner. The value proposition is very clear, clinical and financial. So most times clinical may be weak or financial may be weak, then it won't work. Manasi, I advise you to look at the clinical value proposition of your product. Okay, so what you tell me, there could be something that is not resonating with the nephrologist. That's the reason. It's a great space, but I'm not sure why. So look at it. And second one is product segmentation is clear. Sometimes you have got basic version of product, midware or premium, enterprise. Especially in my previous job, when I ran Health Macro, we had 3 versions, basic, enterprise, and premium. That was for different kind of hospitals and labs. So the prices are different. So you need to be clear and who had to go with what rate, and that level of clarity should be there when you have it. Because you can't go about telling them every morning, do this, do this. All this come like a sales kit, marketing kit. Product or service is proven, testimonials, repeat orders coming in, that's the way. Doctors buy, we have seen them buy good stuff, but just that they also don't want to waste a lot of time checking on the credentials. Oh, this company has bought it, this is that, then go for it. That's the way it should be actually. But if they're asking you, this is, I am your first customer, I am not there, tough to work with channel partners, they too won't take it. And they are also very, very careful before they choose you. Why? Because their reputation is on the line, right? They are the ones who meet them every day, right? So they will say, oh, last time you got me a wrong product. They don't want to hurt their reputation and their business, right? So you need to have that kind of thing. Business model is also clear. What price you sell to the dealer distributor, what price he sets it up, everything is understood, clearly documented. That's the way. So sales process, 1 meeting, 2 meeting, and then you should be able to do. That's called the cookie cutter sales process. Once you have this, you are ready to have a channel partner, dealer, distributor. These are also some names we have of channel partners. Some of them call them as distributor, dealer. Actually, distributor is the one who, in fact, holds inventory in advance. That's why he's a distributor. Dealer, sometimes they hold it or they order it on the fly, actually. This guy is a more skin in the game, he or she. Sales partner is also there. Sometimes they are working in hospitals. They are also doing other jobs. That's also sales partner. Channel partner, they call sales marketing consultants. There are a lot of consultants available, part-time, etc. These are some of the ways they do it. And these are the names, actually, how to recognize channel partners. Examples of channel partners, again, you need not always look at healthcare channel partners. For example, in my previous job, when I was doing health matters, at the time I used to look, we were building and selling HISs and LISs, right? It goes on top of them. There is no conflict of interest. They sell it and they go along with us, actually. So that's the way you can bundle and sell it together also. This is the way you should look at it. Or someone selling medical devices can sell LIS products. LIS is lab information systems. Someone selling reagents can look at it. So channel, what they sell, what else can they take as complementary? That's the way. Characteristics of the channel partners, they keep visiting your prospects regularly. And they need additional sources, so they take up the things. Fast-moving product, I touched this point. Now we will touch upon the important aspects of the model that channel partners work. So one of the most, what I can say, important parameter is it won't work very easily, guys. In case you think, oh, quickly sell ho jayega, no way. It takes minimum 3 months of engagement to check what's happening. They need to understand the product. They need to understand things around where should I position it, who are not customers, etc. So when you engage channel partners, look at a minimum of 3 months of engagement. And some of them look at a retainer model, because if you say, I want a profit sharing, I'll give you when you sell it, it won't work. You need to engage them in a retainer model. They open their collection for a small retainer fee per month. They set up meetings to the prospects. Here is where the strength of your product comes in. From here on, it is just that your product is good. It's a competitive price. You can make a sale. They did their job of go-to-market and opening doors, right? So some of them work in this model. Some of them work in a project base. They use a sales team. But if what we've seen is if you don't have a skin in the game, they too won't have a skin in the game. It won't work. Nurture, they give you leads. Some of them locate the right prospect. They provide a demo, upselling, etc. happens. But what we have seen is we also, when we take on go-to-market services, we also work with a 3-month engagement, have a clear goal in mind, and that's what we do actually. That's how it works actually. So there is seriousness on both sides. Why I tell this is most people think that when you make a sale, kick something out. It won't work. It's very tough to make sales, healthcare sales, unknown products. But you have an advantage of using them because they bring trust and relationships. Hunting, end-to-end sales ownership. Here you can look at giving them larger margins, payments higher, 20% margins, etc. The last kind of category of channel partners who are called as opening doors. For every door they open, they get a finder's fee or which is an actual fee or a 2 to 3% of the amount actually. These are some of the ways to compensate them. Type of channel partners. There are some city-wise channel partners who are small, SMEs, they take it up. Some of them are statewide, very big. Some of them are countrywide. They won't even initially touch because for them, they are only looking at very heavy kind of products, so it won't work actually. They need to look at inventory, exclusivity, international, but go in a very organic manner. That's what I would tell you. That helps you actually. And again, summarizing it, why you need, it increases the reach, they understand the geography well networked. The first sale happens because customers trust the channel partner and not your company, right? That's the important part. Look at channel partners, attend trade shows. Very important. You need to make yourself show. So these are some of the trade shows I personally have attended and seen a lot of value add. Medical Fair, Doctors Association, Arab Health, Medica Germany. Some of them are global, some of them are that. But again, a cost and benefits is always there. Last few things about channel partners. Some of them say, I want exclusivity and all. Don't immediately give it. Let them prove their worth that they know, then only after selling to them, you can just look at it. Give them a geography and then say, let's look at expanding it later. And they have their own fears, emotions, be in touch with them, what's happening, train them. A lot of training is required, guide them, mentor them. That's how it works. Also have an agreement, don't leave things open-ended. It works. Training is very much equated. Incentives to be engaged. Because they will go and find somebody else. You need them more than they need you actually. So a lot of them are there. So maintain good relationship, trust with them. That's what it works. When it's a large city, look at 2 to 3 channel partners. Now for skin in the game, right channel partners. Are they willing to buy your products once they do it? Demo units they call, buying at 50%. And you also need to look at how long are they available? How long are they doing business? The longer they are, they know the domain better. What kind of products they sell? Low cost, high cost. Now you understand where you fit in. If it's high cost, there's a lot of work involved, patience, long-term rewards, depth of knowledge, very, very important. Low cost means just like, yeah, take this kind of thing, etc., fast moving, quick returns. You need to look at all these aspects, right? So now I go on to few things as a summary of the whole thing. Distribution networks, right? So there are wholesalers, there are retailers, there are dealers, distributors. Direct sales, if you have your own team, when to use? Costly product, concept selling, long sales cycle, demo is required, multiple stakeholders are supposed to be convinced to buy it, then use this. You are creating a new category, then use this. The other channels will not work immediately. Costly and long process needed till it hits a product market fit. This is when you use a direct sales. E-commerce, if you know something is very easy to understand product, it's a mass product. It's a Me Too product, but you got some differentiations. No customization is required. You put it on Amazon, it works over there. B2B, B2C customer base, established market, they take care of it. No post-sale support. To do it yourself product. Then you use e-commerce channel. Fulfillment is the only cost you need to bear. Example, Amazon, Flipkart, Meesho, so many of them are. Distributor, I think we talked about it. It's gaining traction. Now you need access. Then you appoint dealers, distributors. Access to network, low cost of sales. Right? Very good one, because it's a win-win on both sides. If you've got the right, and they are also kind of open to doing this actually. Pharmacy, I told, if you're targeting GPs to do it, pharma channel is the right one. You look at MRs, medical reps, take it to them. Last one I will cover on is rural healthcare. A lot of healthcare startups are building products towards that. Work through with foundations and CSRs, Anganwadi workers, programs, PHCs, foundations. That's the way. Very, very different channel. You need to nurture it, build it. It works on a project to project basis. It's not a long-term channel. You need to engage in that way. Home care channel, if you're building something towards home-based care, this is a channel. Today, a lot of hospitals have got home-based care. Try working through with them. I'll give you a use case. Somebody is selling X of a company selling X of a service. Yes. Go through the same company and sell your product, show synergy. For example, I'll tell you geriatric home care is already there, right? Elderly care. If you're selling something about operative care, post-operative care, use the same channel. It's non-conflicting, you can ride on that. Okay, so this is the summary, a few takeaways. Understand your position in the healthcare value chain. Remember the first one, right from screening to rehab, where you fall in. Right channel aligned with the segment. So 3 things you need to do: GTM readiness, go-to-market access, GTM resources. You need to build it. Then only it works. Otherwise, you're stuck in a lot of places. Marketing, continuously keep marketing it. It's more powerful than your product or your sales. If poor marketing, you will be in trouble actually. So always align with the market needs, build what is required. You cannot go wrong. And I'm at what, 5-4. I'll now open it up for questions. Good luck in your journey. And any questions you got, I think I'm also open to, if you guys want to reach out to me, happy to connect on LinkedIn or you can write to me. We also, as I shared with you, provide those services of market readiness, market services, and other things also. With this, I think I'm open to taking on questions. We are at 5:05.
Participants, if you have any.
Sorry?
No, I'm saying the participants, if you have any questions, you can unmute yourself and ask the question to Shashi.
Yeah, you can now. I can take detailed questions, each one of you, now that you know what we do and other things also. So I also want to know more about you guys. Close to 12 to 13 people. What are you guys doing? If you can share, it will be for the benefit of each of you, and you two can connect with each other, post the stuff also. Anyone would like to volunteer what you're building on or attempting to building on? And I also open it up for Jaishil and others. Anything from your journey here in MSMF that you believe have questions here, Jaishil?
Can I?
Go ahead. I don't know who it is. Let me just
Yeah, my name is Ratnakar.
Hmm.
I have extensive experience in healthcare sector. Started my career as a medical representative, then grew up, then into software solutions. Then, I was into the channel partner management, went to all over, major countries in the world, and mainly for the healthcare sector.
Good.
So now my major thrust, I have for my own company, S-Cube Relations, major thrust is in marketing. And also—
So is there a question here, Mr. Ratnakar? What is the question here?
Yeah, question is, I want to get into the channel partnership for healthcare companies. So how should I go about it? How should I, acquire that and give them the service?
You're looking for customers to provide your go-to-market services.
Yes.
Yeah, since you have been there long enough, you have connections, right? So just you have to show the value creation, how you're doing it, and then customers will come. You go with your existing ones or old ones, say, reach out to them. And we have started this. I've been in the space for long, whatever I'm trying to do. And then that's the right way to open up. You have to take on some projects, prove it to them, then the word spreads around slowly and steadily. That's it.
Okay. Should I go, randomly in the open world like that announcing, or is there any particular kind of a channel where I should engage myself in?
See, the whole thing is, it's a very open platform, right? So as long as you're able to show value to the community or openly, if you're putting in some news groups and all, the people will reach out certainly.
Okay.
There's LinkedIn, there is so many other channels.
Okay. Sure. Thank you very much.
Yeah, anybody else has question? Hey, hi Kiran, good to see you. You're on mute.
Yeah, thank you. It was a nice presentation, walking us through the different channels, networks, what can be the last mile connectivity with the different channels. It was very knowledge sharing. Thank you, Shashi, for this.
Hey, thank you all. If there are no other questions, I too will be calling it off, and happy to connect with you and assist you guys. I've given you my links, etc. Look forward to connecting with you all. Have a nice evening.
Thank you, everyone.
Just to inform, the meeting is in the live recording. It's available in YouTube. I'll share the link with you all once the meeting is over.
Sure. Thank you all. Bye.
Thank you, everyone. Thank you, everyone. Thank you. Bye.